Respected physical education teacher and dear students, myself Praveen Mishra, PGT physical education teacher, express thanks to give me the valuable suggestion in my previous video. Today's session topic is Unit 3, Yoga as a preventive measures for lifestyle related disease. Overview of my session is asthma, back pain and arthritis. Under this, procedure benefits and contraindication is there. Now my first asana is Urdhvahasthan, Uttan Mandukasana, Vakrasana, Anulom-Vilom, Ardha-Chakrasana, Bhadrasana and Makarasana is there. We'll discuss one by one. Now my first asana discusses Urdhvahastottasana, that is Urdhva derived from Sanskrit word. Urdhva means upward and Hasta means hands, means up. You can call this upward salutes or upward hands pose in English. What are the techniques are there? Standing upright in the overhead, stretch pose with the finger and with their interlocked. Breathe in, stretch the hands high but keep the feet flat on the floor. Breathe out, slowly bend to the left and right leg. Pause for few seconds at the limit of the bend. Standing up slowly and breathe in. Slowly bends to the opposite side. It may be the right, it may be the left. And breathe out and hold for a few seconds. And straight up slowly and inhale. What are the benefits of this Urdhvahastana? It may be the chances is chest and improve their blood circulation around their thoracic areas, and sometimes the heart, it is related to heart, and sometimes beneficial for respiratory disorders, and it has also help in hypertension and heart problems. What are the contraindications are there? Pregnancy women should be avoided. If you have heavy headache, it should be avoided. If you have any type of insomnia type of activities, you can avoid it. And this type of asanas can do under the guidance of the yoga teacher, or it may be a yoga therapist. Now next asana is Uttan Mandukasana. Uttan Mandukasana, it is derived from also Sanskrit word Uttan Mandukasana. Hold the head in the elbows, and that is called as Uttan Mandukasana. Resembles with their upright just like a frog pose. Now what are the techniques? Sit in a Vajrasana, spread out both the knees, both the toes, but toes should remain together. Fold your right hands backwards from above the right shoulders and place the palms below the left shoulders. Now folding the left hand similar the place of the palm on the right shoulder. One elbow should be on the other shoulders. While coming back to the original position, slowly remove your left hand and bring the knees together as in the first positions. Now what is the benefits of Uttan Mandukasana? It helps to be sometime in the diaphragms movements, improving their postures, removing their back pains, and sometime if you have any the lumbar region pains, it should be relieved. And also it can increase the elasticity of the thigh joints and the shoulders. What are the contraindications? If you have any type of arthritis, hernia, chronic and severe back pain problems, you can avoid it. If you have elbow pains, shoulder pains, spinal deformity should be avoided to perform this type of asanas. Now next is Vakrasana. Vakrasana, it is also derived from Sanskrit word. Vakra means twisted pose, because the spine should be twisted in the practice of these asanas. What are the techniques are there? Sit in dandasanas and the stick pose, both the legs together and the arms by the side of the buttock. Upper body is an angle of 90 degrees with the lower body. Fold the right leg, place in the ankle alignment with the opposite knee. Knee should be pointed upward. Place the right hand behind the body near to the buttock. Place the left elbow by the outer side of the right leg. Folded left arm. Press the elbow again and the right side thigh, and twist your spine from the base of the lower abdomen. Look towards the right side. Open your shoulders. Stay for a 10 and 15 breaths and the natural breathings. Come back in the reverse and weigh and relax position. Do the same with the opposite sides and according to their positions. Now what are the benefits of Uttan Mandukasana? This asana can help to be strengthening of your upper back muscles. It is also a strengthening of your neck muscles. This asanas can be tone up their internal organs just like a digestive systems, intestine, ureters and their kidneys. It also helps the neck muscles to the work and activate of the thyroid glands, and this can be ensured their balance from different type of hormones level of your body. What are the contraindications? If you have good idea of this asana, then you can do. Sometimes you have back pain, back injuries, you should be avoided. Pregnant women also can be avoided. Person who are suffering from the neck pains, those also can be avoided. Upper spine pain or neck pain also there should be avoided. If you are suffering from any type of muscles injuries, it is also can be avoided. Now next pranayama is there, Anulom-Vilom. These asanas are fundamental movements types of pranayama. This also practice also known as Anulom-Vilom. At Anulom-Viloms means produce their reverse orders. What are the techniques? Sit in comfortable meditation asanas. Keep the head and the spine straight. The eyes should be closed. The place should be in the genuine mudra. Close the right nostrils with the right thumb. Inhale through the left nostril from the 5 counts. After the 5 counts of the breath, release the pressure of the thumb from the right nostrils and close the left nostril with the ring fingers. Inhale through the right nostrils from the 10 counts, keeping the respiration rate flow deep and silence. Then inhale through the right nostril from their 5 counts. Inhale the 5 rounds of the practice or from the 3 to 5 minutes, making sure that no sounds to be produced as in air passes through the nostrils. Now what are the benefits are there? Calm, steadiness of your minds, improve also the focus and concentration, balance left and right hemispheres. Now strengthening of their immunity systems. If sometimes it also relieve from hypertension, provide the sufficient oxygen for the functioning of every cell in your body, remove the waste products such as carbon dioxide and any other type of toxic gases from your body so that they do not remain in the blood streams. Now next is Ardha-Chakrasana. Ardha-Chakrasana, it is in a Sanskrit word. Ardha means half, Chakra means wheel, and the asana means the pose. Therefore the Ardha-Chakrasana is also known as half wheel postures. Now what are the techniques are there? Stand straight, bring your hands together in the collapsed positions. Raise and rotate your hands above their shoulders. Slowly bend the upper part of the body along with the hands as far as possible. Remain in the position for the same time, sometimes according to your capacity. Release the position, bring back slowly to the standing position with the hands of your side. There is a variation of Ardha-Chakrasana where the hands placed behind the hips and then back bendings is attempted. Now what are the benefits from Ardha-Chakrasana? Strengthening the back and abdominal muscles, tone up the various organs in the abdomen including their digestive, excretories and the reproductive organs, relief from back problems and the postural defects, open their chest, strengthening the arms and the shoulder muscles. Postures prepare the beginners for more difficult full wheel pose and the other or chakrasana. What are the contraindications? The Ardha-Chakrasana should not done if you are suffering from any neck, hip or spinal injuries. This also if you have high blood pressures should be avoided. If there any pregnant woman, it is also should be avoided. Now next is Bhadrasana. Now Bhadrasana, it means that gracious in yoga. It is consist of 2 words, Bhadra and Asanas. Bhadra is a Sanskrit word. It means the initious or gracious, while Asanas indicates their yoga pose. Now the techniques sit on the mats with the leg fully stretched forward. Bring the feet with the toes pointing outwards. Close the generative organs and the wheel touching the perineum very closely. If required, claps the feet to brings the heel as close to the body as possible. Once the position is secured, place the hands in a respective knees and pressing them down. Keep the neck straight, upper body, chest forward, stomach held in a normal and focused eyes at one point in straight ahead. Now what are the benefits of Bhadrasana? It helps to be loosen the joints and flexible, stretching and their tendons. This also helps the muscles in pelvic, knees and ankles become more supplies, relieve the tension from their spinal regions, provide their relief in case of sciatica in various veins and menstruation disorders, prevent their arthritis, and also they improve their postures. What are the contraindications? Although the beneficial of their preventions from their arthritis, practitioners with the serious of their arthritis and should be consultant yoga expert before the practicing this type of asanas. Now next is Makarasana. Makar means crocodile and Asan means posture. It is also known as called as crocodile pose. What are the techniques? Lay down on the floor on your stomach with your hands. Fold the upper head. Place the right palm over the left palm on the grounds and place the head over the right palm is in a relaxed way and close your eyes. Stretch the leg as far as possible. The toes should be pointed outward. Relax the whole body. Breathe normally and slowly. Feel the whole body touching the grounds and deep relaxation in your muscles. Relax in these postures in a few minutes. While returning the postures, slowly bring the feet together, unfold the arms and come on the prone positions. What are the benefits? Are there deep relaxations to the shoulders and their spines, reduce the waist pain, help in a spinal disc, asthmatic and the patients with their lung disorders, and also relieve in the arthritis pain patients. What are the contraindications? Practitioners should there in the second and third transmits the if you have any the pregnancy problem should be avoided in the Makarasana in a prone postures. Now what are the references which I was taken? Purely the curriculum in 2024, 25 and the book which we are using in the CBSE handbooks which were easily available in the CBSE academic site. Thank you.